Hi guys, this is Dr. Samal Yazad. What I'm going to do today is that go over some of the structure associated with the lower limb and talk about those and identify them, and hopefully that's going to be useful for you. Looking at the model here, we're going to start from the thigh bone, which is connected from the pelvic area to the knee. It's a very large and very strong bone because of its weight-bearing activity that it has. The upper part of these structures that you can see here, this is the head part. The head part is the one that actually fits right into the acetabulum part of the pelvic. And right down the center here, you can see there's a small hole. This little small hole is an area where the ligamentum teres is located, which connecting it right into the acetabulum. Extending from the head part, we're going to get to the neck. And from the neck, you can see the angle and everything is going to go inferior. We have this large mass of bone here known as the greater trochanter. And this one is known as the lesser trochanter right in these sections. Then from there, we get to the shaft part and all the way down to the end part. Then you can see these two knobs like a structure which are known as the medial and lateral condyle of the femur. Then a couple of bumps on the sides which are known as the medial and also lateral epicondyle of the femur. Here is known as the patellar surface. Then looking on the back side, you can see this line which is known as the linea aspera sitting right there, and right down here is known as the the patellar fossa, right in this section. Then you go to the next bone, which is the patella sitting here. You can see the pointed edge known as the apex part, and the top part is known as the base part of it. And underneath is going to be the patellar surface, when it's going to be producing attachment right alongside of the femur part. The next bone is known as a tibia that extend all the way from the knee region to the ankle. The parts on either side, we have the medial and also lateral condyle of the tibia. You come to the front, you have this little bump structure known as the tibial tuberosity, and extend all the way down in that section. We're going to be the bone itself. When it gets to the end part, you have this little mass of tissue that produces the medial malleolus. The other bone that sits on the lateral side is known as the fibula. This is the head part of the fibula, and the end part of it, which is at the ankle region, produces the lateral malleolus. The connection here on top part, or the medial part of the tibia, known as the fibular notch. Remember, the fibular notch is located on the tibia. Then these two bones together to produce this tibial plateau, and this tibial plateau is connected to the bone here known as the talus. The talus is attached to the bone below known as the calcaneus. Calcaneus has this little bump here known as sustentaculum tali that it sits right in this region, produce some type of articulation with the talus. Then you come to the metatarsal bones. We can see we have 5 of them on each leg. We start from the medial to the lateral. The medial one, the proximal row, is going to be navicular. Then I have the cuboid. Then I have these 3 ones, which are known as the medial, intermediate, and lateral cuneiforms. Then you get to the metatarsal bone also here that produce the sole of your foot, and of course the phalanges, which are sitting there. The only thing that is a little bit different here, you have this little tuberosity that is sitting here in the proximal part of the 5th metatarsal in this region. This is known as the tuberosity of the 5th metatarsal. That's pretty much is going to be covering everything that you should know for the lower extremity. I hope that you found it to be helpful. Thanks for watching.